So let's start. Good morning. Welcome to the press briefing of the UN in Geneva. Today is Tuesday, 15th of July, and we have a few colleagues to brief you on events which have been under the lights recently. We have all seen, I think, over the weekend, the tragic events that happened in Gaza, across Gaza, resulting in mass casualties, including among children. To talk about this, we have with us, and thanks for being with us, Juliette Touma, the Director of Communication of UNRWA from Amman, and we also have our colleague Tamim Al-Kitan from OHCHR, and we will hear from both of them updates about the situation in the occupied Palestinian territory. I'll start with Juliette. Juliette, welcome. Thanks for being with us. You have the floor. Thanks.
Thanks, Alessandra, and good morning, everyone. Like Alessandra said, I will give an update on the occupied Palestinian territory, and I also speak to the work of UNRWA that we continue to do through our teams on the ground in the OPT, and then I'll end up with a couple of announcements. So on the Gaza Strip this morning, I will focus on latest data that we got from our clinics, our medical points in the Gaza Strip, specifically on malnutrition on children, among children. Like I said, this is based on latest findings. Our doctors, our nurses, our health teams are confirming that malnutrition rates are increasing in Gaza, especially since the siege was tightened more than 4 months ago on the 2nd of March. So we've seen in our clinics an increase in malnutrition among children. Since January 2024, so over a course of a year and a half, the UNRWA health teams screened in the clinics and medical points of UNRWA across the Gaza Strip more than 240,000 boys and girls under the age of 5. So the age range is from 6 months to 5 months old. Currently, 1 in 10 children screened in those clinics and UNRWA facilities is malnourished. 1 in 10 children. Before the war, acute malnutrition was rarely seen in the Gaza Strip. One UNRWA nurse that we spoke to told us that in the past, he only saw these cases of malnutrition in textbooks and documentaries. Today, he's treating them face-to-face in the UNRWA health centers. The growing number of children in need of therapeutic treatment risks overwhelming the already devastated health system in the Gaza Strip. I'll tell you the story of Ahlam. She is a baby girl that our teams in Gaza have been treating, and they told us her story. She's only 8 months old. On average, since the war started on the 7th of October, her family, Ahlam's family, was displaced almost once a week. She now lives in a tent with 5 other family members with not much food available for Ahlam. She is severely malnourished despite the care that she is getting from the UNRWA health teams. Her condition keeps getting worse by the day. Like many other babies in Gaza, her immune system has been damaged by trauma, constant forced displacement, lack of clean water, poor hygiene, and very, very little food. There's very little therapeutic supplies to help children with malnutrition in Gaza. Medicines, nutritional supplies, hygiene material, fuel are all rapidly running out. UNRWA also ran out of food, if you recall, at the end of April this year. UNRWA continues to be the largest humanitarian organization in Gaza. The agency, however, has been banned from bringing any humanitarian aid to Gaza, including nutrition supplies to treat babies like Ahlam for more than 4 months now, since the 2nd of March. As of this morning, UNRWA ran out of nearly 60% of essential medicines. As an example, we no longer have medicines to treat patients with hypertension, and the agency's clinics ran out of antibiotics for adults. As malnutrition among children spreads across the war-torn enclave, UNRWA has over 6,000 trucks of food, hygiene supplies, medicine, medical supplies outside of Gaza. They're all waiting to go in. During the ceasefire between January and March, mid-January to mid-March earlier in the year, the United Nations, including UNRWA, were providing at scale and dignified assistance to people. We managed through that work to reverse the trend and the deepening hunger, including among children. This functioning system was replaced with one that takes more lives than it saves. While there is a lot of focus out there, you might see on social media and in the media on food being distributed, the people of Gaza need more than just food. Above all, they need safety. But no place is safe in Gaza, and no one has been spared. The people of Gaza also need medicine. They need hygiene supplies like soap. They need water, sanitary pads for women and girls, diapers for babies and older people. And they need nutrition supplies for babies like Ahlam. It is more than just food, let alone feeding people. The UN, including UNRWA, must be allowed to do our work, also for the sake of children across the Gaza Strip. I'll say a few words, Alessandra, on the situation in the West Bank, and then I'll say a few words about the work of UNRWA. So on the West Bank, including East Jerusalem, we continue to have a silent war that is surging, where heavy restrictions on movement continue, where poverty is increasing as people are cut off from their livelihoods and unemployment soars. And it's great to have Samin online because he'll give a much more detailed briefing on the West Bank. The impact of the ongoing military operations by Israeli forces and the violence by Israeli settlers, they're forcing more people to be displaced. According to our UNRWA colleagues, this ongoing operation has been the longest since the 2000s during the Second Intifada. This is mainly in the northern West Bank. It is impacting several refugee camps in the area, and it is causing the largest population displacement of the Palestinians in the West Bank since 1967. Just a few words on the work of UNRWA and to confirm and emphasize and ask the media to help us to continue to say that UNRWA continues despite all these challenges, despite a very, very challenging financial situation and a crisis that the agency is going through, despite all the hurdles that I've mentioned to you across the occupied Palestinian territory. Our teams continue to work. We have a staff of about 14,000 people across the OPT who continue to deliver services and assistance, not only to Palestine refugees, but to people in need, especially in the Gaza Strip. And I'll give you a few examples. On average, every day, despite everything in the Gaza Strip, our medical teams, our health teams, continue to give 15,000 consultations a day in the UNRWA clinics, in the medical points across the Gaza Strip. In total, since the war began, the health teams at UNRWA gave over 9 million health consultations. Only this year alone, we've provided domestic water and drinking water to 1.3 million people in the Gaza Strip. That's about 60% of the population. Our teams continue to manage shelters for displaced people with more and more forced displacement orders from the Israeli authorities. More people are forced to flee, and they often come to UNRWA shelters, which the agency continues to manage. We've reached, last but not least, and very important, we've reached more than 500,000 boys and girls with psychological support across the Gaza Strip. In the West Bank, the school year has just finished a couple of weeks ago, and we were able to continue to provide education until the end of the school year to about 40,000 boys and girls who went to UNRWA schools in the West Bank. And hundreds of thousands of people continue to go to UNRWA clinics in the area. And like I said, in the northern West Bank, because of the displacement, there are humanitarian needs of people who are being forced to flee, and UNRWA provides them with relief and basic assistance. In closing, just to say that we have a few resources that I will share, Alessandra, with you, that we've updated. A couple of documents on our website that I'd like to bring to the attention of the media: the claims versus facts about UNRWA. That's been updated, made available on the website. We've published last night a blog on nutrition and the children of Gaza that can be republished in media outlets, and I'll send that. And we also have quite a lot of multimedia material, so photos and raw footage and B-roll, and also videos on the nutrition of children in the Gaza Strip. Thank you, Alessandra.